here. We have Tolu here and Olivia here. She just started yesterday. Welcome her to the game. And so I'm going to introduce our speaker. This is Connie Marlowe. She's over here with Health Services, and she is the Assistant Director of Office Operations. And so she will be providing you with all the relevant information today. Connie?
Thank you. Welcome, everyone. I'm going to have to look on the phone for you. So I'm going to just do a brief, I think we have about an hour, a little bit over an hour. So I'm just going to do a brief overview about what insurance is and like terminology that we use in the United States. Then I'll go about how to get care, how to access care, and then what an explanation of benefits are. And we'll go over just basically things I was told that you might have questions on. And then if it's too detailed or it's confusing, please raise your hand throughout the presentation. And then afterwards, I will go ahead and take some FAQs or some questions. So there's the quick agenda. So insurance, do all of you have the student health plan with Aetna? Everybody stayed on the Aetna plan? Maybe. So in the United States, it's different than when you leave the country. Our insurance plans, we have deductibles and co-insurance. So these words I'm going to talk about are what are the essential words you need to know when you process claims using the insurance plan in the United States. And this is any insurance. This isn't just school specific. A deductible is the first amount of money that you're going to pay out of your pocket. So most insurance plans have a deductible of $500, even $1,000, where the patient is expected to pay that amount of money out of their pocket before the insurance company pays anything. So like I said, with the healthcare reform, most of the deductibles nowadays are between $1,000 and $5,000 for most insurance plans outside of the university. If you go to the government marketplace or employer plan, they're usually much higher deductibles. And again, that is year round. So most employer plans or any plan outside of the health center start in January and end in December. The school health plan that you guys purchase goes August to August. So it's August 15th of this current academic year to August 14th of 2023. A co-insurance is the percentage of the amount that you will pay of your bills after you pay your deductible and the insurance processes the claim. So typically it's 80-20. The insurance company pays 80% of the allowable expenses on your bill, and then you're left with the remaining 20%. And that is in addition to your deductible and then your co-insurance. A copay is different than a co-insurance, and that's where it's just a flat dollar amount. It doesn't change. Most copays are for prescriptions or emergency room access fee. Some specialty plans, if you're lucky enough to go to an employer, you'll have copays at your doctor's offices. So if you work for the University of Notre Dame, you have a $30 specialty visit, meaning when you go see a specialist in the community, you pay $30, and the insurance company takes care of everything else that you have done on that day at that doctor's appointment. The student health plan that we offer to you, it has copays on campus of, at the pharmacy, it's a $5 copay for a generic drug, and then a $30 copay for a brand name prescription when you come to St. Leon's and you use the Walgreens on campus. So most of the benefits are much better when you stay on campus and you use the health center when you can. If you have dependents and they can use the wellness center, these benefits would be the same for the dependents when you go to the wellness center on campus as well. When you go to the community, to any pharmacy, whether it be Myers, Walmart, CVS, or Walgreens, any of those pharmacies, you're going to pay a co-insurance or a percentage of the amount of the cost of the medication. So instead of paying $5, you're going to pay 20% of whatever the cost of that generic drug is. So you'll send the prescription to Myers. Myers will say it's $20, and you're going to pay 20% of the $20, which I think is $4. I'm not that great at math. So that's a copay. So copay is flat, never going to change. And then a co-insurance is going to be a percentage of the cost of your claim or your medication. Also within the United States, most of our plans have an out-of-pocket maximum. An out-of-pocket maximum is the amount of money that you pay out of your pocket before the insurance goes to 100% coverage for the remaining portion of the calendar year. The out-of-pocket maximum usually includes your deductibles and your co-insurance and your co-pays. So everything that you purchase or that you've used your insurance towards accumulates to this out-of-pocket maximum. The student health plan is $6,000 per person or $12,000 per family. And if you do have a family plan or dependents on your plan, one person has to meet the $6,000, and then the rest of the family members all accumulate towards the second $6,000 before it would be considered out-of-pocket maximum has been met. And then again, once you meet that maximum, then everything that you have for the remainder of the year would be paid at 100% by the insurance company. It resets every year. And for us, it resets every August. It will start all over. So if you had nothing expensed or nothing met towards your out of pocket, you'll start in August with the same thing, 0. If you've had a lot of off-campus expenses and it was, say it's $4,000 come August 15th, the slate gets wiped clean and you go back to 0. And it starts all over every August 15th. We also have something differently in the United States. We have in and out of network providers or preferred care providers and non-preferred. The PowerPoint says preferred care, so we will stay with preferred care. Preferred care providers and facilities are those providers who contract directly with the insurance company. So with us, it's Aetna. So when you go to the Aetna website, you want to look for Aetna providers. And if that means that they have a special contract with our providers, and they'll give them discounts at the time of service. So health services on campus, when you visit any of our physicians on campus, they're automatically paid at 100% because we're on campus. Once you go off campus, say you're going to go to Memorial Hospital's MedPoint, you're going to then be subject to your $500 deductible, which is in network. And then that provider is going to give you a discount for using him. So instead of, and randomly, I'm going to say they give you a 20% discount, they're going to, your visit's $100, Aetna's going to take 20% off of that $100, and then they're going to consider $80 as the overall total for that visit, and then you're going to pay 20% of the $80. So when you want to stay in network, it's cheaper to use contracted providers in the community as well as wherever you go. And every provider and facility is different. They all have individual contracts with the insurance companies, and they can give you discounts up to 6. Yep.
All of that is after the deductible of $100?
Yep. Yep. So once you go off campus, it's the deductible first, but no, the discounts are applied to the deductible as well. So if it's your first claim off campus and it's, I'll say $200, that $200 is going to be sent to Aetna. And then if there's any discounts, they're going to take your discounted amount off. And then whatever is remaining is the amount you pay and goes towards your deductible.
But yeah,
It's like a coupon. Yes. Yeah. And the insurance will still count it towards, they count down from 500 all the way to 0. Once it's satisfied, then that's when they start paying everything at their percentage. Any more questions on specific terminology? Okay, so one of the things I wanted to make sure that you all know is how to access care. So when you're all on campus, or at least within 20 miles of campus, we ask that you come to St. William's Hall. And that is because we're the gatekeeper for the Aetna policy. We try to keep your claims cheaper and more affordable. We know where to send you for the appropriate care in the community. And then our pharmacy and lab on campus all are much cheaper for you out of your pocket than if you went to an off-campus facility. So we ask that when you're here, and you can, that you come to our health center, and we're open Monday through Friday, 8 to 5 every day except for Thursday, it's 9 to 5. And when we are closed, if you call our number, which you see there's the 631-7497, if you call that number and we're closed, it automatically will roll over into a 24-hour after hours nurse line, and you can talk to the nurse there. Tell them what your symptoms are and you're experiencing, and then they can help you and direct you to appropriate care in the community. They sometimes can even follow medical directives and prescribe a medication to you that you can pick up in the community if you want to. If you feel like you need to physically see a provider or talk to a doctor, then you can also do our timely care, which is virtual telehealth appointments, which are free to all students on campus. So when you call our number, it will give you the website for Timely MD, as well as it'll direct you automatically to it'll roll over to the nurse line phone. So you have both choices when we're closed. Know that the timely care does not use your insurance. It doesn't get billed to your insurance. It is absolutely free to you, to all Notre Dame students on campus. Even if you're in California, you can still use timely MP, and it will pick up where you are. So you have multiple options when health services is closed. In our building, we have health and wellness. So we have the McWell, the Center for Students. We have University Counseling Center, which is made up of psychiatrists and psychologists. And then we have on our first floor and second floor, we have physical therapy, which is for McDonald's physical therapy. And we also have LabCorp, who is an independent lab on campus. And then we have Walgreens as well. And then we also have our own x-ray machine. So we have an x-ray tech who works for the university, and then she can take your x-rays, and then that again is covered at 100% under the student plan. If you chose not to have the insurance plan, you would get a bill that you would then have to submit to Aetna for reimbursement, or to your insurance company for reimbursement if you choose not to stay with the school plan. But we try to have everything in-house so that when you do call us and come see us, you don't have to go anywhere. If for some reason you do have to go off campus, we do provide Uber to you to take you to and from your appointment. And if we referred you off campus, then we would cover that expense one time. And then if you have to have multiple visits, and say you want to go to counseling off center, off campus, we'll pay for the first Uber, and then you can use us to schedule Ubers going forward, or you can schedule your own Ubers from there on. But we will give you one free Uber to and from your appointment if we refer you to that appointment. Any questions on that? Okay, off campus. So off campus is a little different. So on campus, we try to have everything in house. If you have Aetna, everything gets billed directly to Aetna and is covered at 100%. You should never see anything hit your student account when you visit us at health services. You will get a bill from our LabCorp facility because they are independent. They file with Aetna, but you will have a small bill from them if it's not a routine lab. If you have to go off campus, and so it's after hours and you don't feel well and you don't want to use timely MD, I recommend that you go to an urgent care facility first. And Beacon is the only one, Beacon or Memorial are the only ones that I know still have later urgent care hours. They're over on Grape Road and Main Street. They're open till 11 o'clock at night, usually Monday through Friday. I would recommend they're cheaper and they're usually less wait times if you have to take a family member or if you just don't feel good. It's less time that you have to spend in the facility itself. They are also in network with Aetna, and you would get reduced rates when you go to those providers as well. If urgent care is not available for you and you don't think you can wait to the next business day to see one of our providers, then I recommend you go to one of the hospitals. Memorial Hospital and St. Joe are both in the network. Memorial Hospital definitely works better with our students for financial burdens. So hospital bills are much more expensive than an urgent care. You'll be charged for the emergency room, and then you'll be charged for the emergency room physician or nurse practitioner. And then you'll have individual lab bills and x-ray bills if that's what they do to you while you're there. All of those bills come individually. They don't come on one piece of paper, so you'll get multiple bills when you use the emergency room. But Memorial Hospital, I will tell you, they have a financial assistance program. So if you can't afford your bill or you just have trouble this month paying it, I can send you an application to Memorial. You fill it out. It does ask for tax information and social security number, but it's all confidential. They put it through their review board, and usually within 48 hours, they'll grant you some type of assistance. I would say 99% of the students who have used it have gotten at least 80% of the bill reduced, written off, and you're just stuck with a small trivial amount that they look at your needs and they think that you can afford for that time. And usually once they grant it to you, it's good for 6 months. So if you have to continue care, you can keep going back to that provider, and the financial assistance program is in place for 6 months. So anytime, if you have a choice, Memorial, I know I should tell you, but Memorial works better for financial assistance programs. St. Joe is a great facility. I haven't had as much luck in getting financial assistance from them for our students. So that's why I don't refer to them as much, because it's harder. They don't give you as many benefits for financial reasons. So how insurance works, and this is really basic. So you look for a provider in the community because you're sick, and depending on your care, you can come see us first. If you choose to go anywhere else, you pick the provider you want to go to. You call them to make an appointment. And when you go to the appointment, you give them your insurance. If they're in network with our insurance or with any other insurance, you pay nothing at the time of the appointment. They will send the bill to your insurance company. You'll get a copy of the bill a couple weeks later in your mail, but you won't have to pay anything until the insurance sends you something saying this is what we paid to them and now this is what you owe. The only times you would ever have to pay up front usually is with an out-of-network provider, and they won't file a claim for you either. You'll have to take a bill and send it to your insurance company, and you'll have to usually pay the bill at 100% in the office if you're an out-of-network provider. Once the claim is processed with your insurance company, you will get an explanation of benefits called an EOB in the mail. You can choose to get those digitally or in the mail as a paper copy. And once you get that, you should then in a couple of weeks get a bill from the provider, and you'll be able to match them up. You should see that on 12/12, my bill is $1,000, and your bill from your explanation benefits should also say on 12/12 your bill is $1,000, and you'll be able to put those two together, match them, and find your discounts and find your what you actually owe to the provider. And then if it's something you can afford, you call the provider and either pay it up front or you make payment arrangements with them. If for some reason you need help, you can always call me and then we can talk through the bills that you get. Again, as I said, an explanation of benefits is an electronic or a letter that you receive showing how the claim is paid. And it has how much you put towards your deductible. It shows what your copay is or your co-insurance amounts, how much you've met towards your out-of-pocket maximum for you and for your family. And then it will also show discounts or negotiated fees. And then if there's any penalties. And I put penalties on there because every explanation of benefit that you'll get, it has little footnotes, 1, 2, 3, 4, whatever. And then on the bottom of the explanation of benefits, it tells you why it exists. And sometimes you'll have a penalty if you have to have a pre-cert prior to care. If you need a referral from health services to go off campus, you have to do a referral or the penalty. If you ever see penalties on your Aetna explanation of benefits, let me know because usually the referral is there shouldn't be anything that you should penalize from the first unless it's a referral that you did come from. And we always have to. Any questions so far? And I know it's a part of so the next thing I'll talk about is special. So our design it does include a vision discount for anybody who they want to have. It automatically comes with a vision discount. If your medical card, use the vision card. Again, you have to access the website and call them and make a for you. The medical vision plan will cover eye exams, contacts, glasses, things like that. But it's at reduced rates. So a lot of times you get 60% off of price of contacts or frames or it's a discounted rate for the COVID. But you have to for the scan for glasses and the actual bill is $750. They're going to reduce that by the contract amount from and then you have to pay for it. So it's not an insurance plan, it's a discount program, but it does give great deals with providers. And it does work all the way through the so the dental plan is the same thing. There's a discount dental plan with Aetna, which is $35 for the whole year. You buy that plan off the website and it goes into effect once your payment clears, whether it's 48 or 72 hours. And then again, you find a dentist to accept your card, and the same thing. They'll tell you what they can do for you, and then they'll give you the reduced rates, and then you pay at the time of service for your dental care. You can also buy a dental insurance plan through Aetna, which is based on your age, and it is a monthly premium. So you would pay anywhere between $30 and $60 a month to have the dental insurance plan, which will have a deductible and co-insurance, just like any other plan.
You know, which dental providers they have a website and those ones that they have providers and they show them.
In South Bend?
Yeah. I think it went on the website. I think they built it in private.
Yeah, there should be a lot in South Bend.
Right there, it's going
I
to
can look
the-
for you after we're done. I can look. Make sure, usually put in the put in the South Bend or the Monday for that in the video. So I think I would do a problem, but there should be at least 15 to 20 to 30 dental. Are you talking the discount card or the dental insurance? The discount card, yes, that should be a lot of it. And then I can it's the same, the discount card is the same card, that you will have, you just have to pay to enroll. And then the discount card, like I said, it's effective as soon as your claim processes, the payment processes. If you actually buy the dental plan, it's the first of the month following when you pay for it. So if you buy it today, you won't be able to use it until October. And that's just because it's an insurance plan and it starts on the first of the month. It's good for 1 year from the time you buy it, but you do pay a monthly premium for that. And you'll get a different card for that. And then there's also the Delta Dental Plan that is offered off the University Health Services website. Same thing, it's an insurance plan. There's a monthly premium to it, but you can choose from two options. There's a lower premium for a lower benefit, and there's a little bit higher. Neither one has pre-existing, so it covers everything from the day you purchase it. And then you, it's the same plan that we offer to the non-named retirees. It's offered to all retirees and all students dated. But again, it's a 1 year commitment. It is a monthly premium, and theirs is a little bit more expensive than the Aetna plan. It goes up to almost $300 to $375 per year. Okay, so in regards to that's most of the insurance thing, but I want to basically just talk to you about what I do. So a lot of students come here for the first time without their parents or on their own from their home country, and they really don't know what insurance is. So my job here is to help you and to make sure that the claims they receive, whether it's a student health plan or not, are priced appropriately, they're processed appropriately, and if you can't afford them, then I direct you to places in the community or the facilities to help you get financial assistance for those bills. So at any time, if you have any questions, please feel free to stop by, email me, or call me. Email is usually the easiest way to get a hold of me. And if you have a copy of your explanation of benefits or anything, you can drop it off and ask me to look at it. I will then look at it and then reach back out to you to help you. And if I think it's okay, then I would tell you that I think that the claim is processed accordingly. And then we'll go from there in regards to financial assistance. Most facilities in our area, like I said, they offer some type of financial assistance programs to our students. It's just not all of them grant them. Memorial has been the one who has really given us the most benefits for our students. And I think it's because so many kids go there, but I mean, they have always given us a lot of help. And they work with our students if they need a monthly payment plan to pay their bills. If none of those work for you, then we also have on campus what they call the Shirt Charity Fund. So every year, the students who buy the Notre Dame football shirt, all of that money is kept into a pool of money to help for medical assistance or medical emergencies, catastrophes that impact our students. And it only does cover the student. It doesn't cover spouses or dependents. It is just for the student. So if for some reason you went to St. Joe and you had massive surgery and it was well over $12,000, I would help you. I'd send you the Shirt Charity application. You provide what happened. You have to answer 3 or 4 questions, and then we send it anonymously to the board. And there's one staff member who runs it, and the rest of them are students, and they are given a brief overview of what has happened, and then they weigh and they decide on if they can give us any money to pay the bills or not. And they'll deal directly with you. They don't tell me, but I just handle the application for you, get it to them in time to process everything. So that helps a lot of our students. We do help almost 80% of our students who apply, and don't feel like any amount is too little or too much. They will help you with anything that you need. So number one thing is please don't be afraid to ask for help. Okay, that was a lot. So do you guys have any special questions or individual questions?
Yeah. When are you going to speak
For your card?
just process for the application?
Oh, so your card is already activated. They start August 15th. You won't, so the waiver site closes the 15th at midnight. You should get it within the next 3 to 5 days. So once the site closes for everybody given the opportunity to waive out, they close the site, we process all the waivers, and then I upload the final file to them, and then that triggers the email. So I would say by the 22nd, you should have everything. But if you need your card now, you can print it. And you can also get a copy of the brochure and everything now if you need. You go to the EtnaStudentHealth.com website, type in University of Notre Dame where it says find your school. And then the second page it says print your ID, and you use your Notre Dame ID number and your date of birth, and then you'll be able to print it or save it to your copy of your card. You then would in turn use that ID number off your card to create your Aetna Navigator account, which allows you to see your explanation of the benefits, find discounts that are given through the student health plan, and all the other things that the Aetna promises to the students. You can do that with the Aetna ID card. No, we don't mail cards anymore because the student's addresses change so frequently. So you actually, if you need a hard copy, you call them and they'll send you one. Otherwise, it's just the one you print or download. Can you just forward it on the PowerPoint? Will you forward it on to? Oh, yes. Yeah.
Is there any way to understand how many for the provider they are?
So because we picked Aetna because the majority of the providers in our community are with Aetna contracts, the one we struggle with is mental health professionals. We don't have a lot of psychiatrists in the area that are contracted with Aetna. But we do have a small list of those. I think we have about 12. The hard part is getting a provider who's taking new patients. Most of the mental health providers are already booked and they don't take new patients. So we always have to wait for the new people to hit on and try to make connections with them. But if you are looking for somebody special, I can help you. Otherwise, you just go to that same website, put in what you're looking for, and it should pop up what you need.
They provide a list.
Yep. So when you go there, it's going to be pages and pages, and you can download a PDF of it, or you can just scroll through to find out who you're looking for. If you know a specific name, you can type in the name and it'll tell you if they're in the network or not. But if you're looking just to go somewhere, it'll give you a bunch of people that you can. That's the best way to go is to see us at the health center. Correct. You're supposed to, unless it's trauma. So you think you're having a heart attack, you cut your hand off. Only if it's traumatic are you supposed to avoid the health center, because we want to make sure that we can direct you to the appropriate place. If it's an emergency, you go wherever you can, the closest facility, wherever. But if it's Monday through Friday more available, we do try to ask for you to come see us first. But you have the right to go wherever you want. Correct. The payment changes, what you owe changes if you don't come to us. So if you come to us, it should be free. Basically, you shouldn't owe anything to anybody because insurance here will be covered at 100%. The minute you step outside of the health center is when you start to incur the costs. Yep. So anywhere, so the United States is in or out of network. So it's the $500 deductible or the $1,500 deductible. Once you leave the United States, it's the $500 deductible and 80/20. So everything outside of the U.S. is considered in network. And one thing I forgot to talk about was the Aetna plan also has a travel assistance program through On Call. And On Call, when you get the email from Aetna, there'll be an On Call number or a card. And this is a provider that helps you wherever you are, as long as you are more than 100 miles from either campus or from your home. If you need assistance finding a provider, if you need assistance paying a bill, if you need, something happened to you and you need medical transportation, it will take care of all of that for free. no cost to you, as long as you call them first. So when you travel outside of the United States and you're just sick, then you just go to a provider and, pay your bill like normal. If you get into an accident and you have to be airlifted or flown for better care, you call them or the friends you're traveling with or your department advisor. Anybody can open the case for you. And then on call will take care of all your transportations and medical expenses to get you safely to the next place of care for you. It's a very good benefit. I hope nobody ever has to use it, but it's there in case anybody does. It also does the same thing for your family. So if you're sick here, it'll fly. I don't know if you're married or not, but it would fly a family member to stay with you while you heal and are better. And the same thing if your family member back home is ill or in the hospital, it will fly you to stay with that person and at no cost to you until that person is better, and then they'll fly you back. Yes, they will. No, you have, if you leave the country on your own, you're fine. It's only when something happens to you, you call first, and then they'll make all the arrangements and cover the costs for you. The dental? Yeah, so any dental plan, whether it's the Aetna or the Delta dental, yeah, they have a maximum, depending on the plan, it's either $1,000 that they'll pay out or $1,500, whichever plan you take. The only dental that is covered under the medical plan is if you have wisdom teeth removal. So if you have wisdom teeth, and those are those back teeth that bother some people, if they're underneath the gum line or underneath the skin, then that's covered under medical to get them removed and extracted. If it's just they're already broke the skin and they just need pulled, then that's when you would use your dental plan. But if they actually have to have surgery to be removed and put you under with anesthetics, that would be covered under your medical policy. And then if you don't want to have dental insurance, you can go to Act Dental, which I think there's one on Grape Road and one on the south side of town. They will do free consultations on students or people, give you a whole workup of what's wrong and what you need, give you a pre-estimate of the cost. You can then make the decision on what you want to do. If you want to go with the dental plan or a discount card, you can take that and then weigh your cost, what's going to be the most expensive or the best for you. But AFDET will give you free consultations and a predetermination of all the services you have, and then you can make your decision from there. We also have an IUSB dental school, which does cleanings and stuff for like $15, $20, much cheaper than community dental. But it is a dental school, so but they are available to the community. Any other questions? I left some cards here, so if you guys want my cards, my email and my name, and if you want to have any questions, please at any time feel free to email me or come see me. Thank you.
You're so welcome. And I just want to thank you all for coming and just pay attention to the rest of our info blitz sessions this week that ISSA will be hosting. There is one tonight in this room, and that is on work opportunities post-graduation, and there will be an immigration attorney present. If you haven't already registered for that or others, just please look into that on our website. And please help yourself to the rest of the food back there. Thank you.